Hello everyone and welcome to this presentation on blood cultures. My name is Jamal Arbei and I am a laboratory specialist with extensive experience in microbiology. And over the years I've worked closely with students and professionals to help them build a deeper understanding of laboratory diagnostics. In this session we will explore blood cultures in detail, breaking down each step of the process from specimen collection to interpreting results. My goal is to provide you with clear and practical knowledge that you can apply directly to your studies or clinical practice. So blood cultures are a critical tool in diagnosing infections, especially bloodstream infections that can be life-threatening. They guide accurate treatment and play a vital role in improving a patient outcome. Whether you are a student preparing for exams or healthcare worker refining your skills, this presentation will give you a valuable insights to enhance your expertise. I encourage you to take notes and ask yourself questions throughout this session. And I can assure you that by the end of this presentation you will not only understand the technical aspects of blood culture but also appreciate their importance in saving lives. So let's get started. So what exactly is blood culture? Blood culture is a test where we take a sample of patient's blood and place it in a special bottles with growth medium to see if any microorganisms grow. This tells us if bacteria or fungi are present in the bloodstream. Why is this so critical? Because a blood culture not only helps us confirm that there is an infection, but it also tells us what's causing it. And this is the key for selecting the right treatment, and without it, we are essentially just guessing. There are three main things we achieve with blood culture. We confirm if the patient has an infection, we pinpoint the specific organism causing the problem, and most importantly, we provide the doctor with the data they need to choose the best antibiotic for the patient. So the presence of bacteria in the blood can occur for a variety of reasons. It may be transient and harmless, and with everyday activities like brushing your teeth, flossing, and chewing food, which can allow a small amount of bacteria to enter the bloodstream temporarily. Medical and dental procedures such as tooth extractions or surgeries are also common cause of these microorganisms, which will be usually short-lived and resolved by the immune system. However, persistent bacteremia is often linked to infections such as pneumonia, urinary tract infections, and abscess, where bacteria from the infection site spread into the bloodstream. In some cases, implemented medical devices like central lines or prosthetic valve can be a source of bacteria. Additionally, lifestyle factors like IV drug users or an open trauma wound can directly introduce bacteria into the blood. So, in case we have a patient that is or has been diagnosed with septicemia, it's important that we understand the source of the infection. So we can we can stop the spread of the infection. We need to find the source. For example, if there is a wound or there is an abscess, it has to be cleaned, it has to be drained, antibiotic should be introduced, then you can successfully resolve this infection. So understanding the source is critical for effective treatment and preventing the complications such as septicemia. Now that we understood blood culture and why it's important, let's move on to discussing when we should order this and how to ensure that we collect it properly. So proper specimen collection is the cornerstone of accurate blood culture diagnostics. Start by choosing the correct site, which is peripheral acupuncture is preferred to minimize the contamination. Through catheter samples may be taken in specific cases, but it's usually not recommended. Next, consider the volume. For adults, it's crucial to collect from 20 to 30 ml per set to increase the likelihood of pathogen detection. In pediatric patients, the volume should be adjusted according to their weight, typically between 1 to 5 ml. Timing is another key factor. Always draw blood culture before starting antibiotics, as this ensures you are capturing the true pathogen without interference from therapy. It is also important to collect from 2 to 3 sets of blood culture within 24-hour periods to improve diagnostic accuracy. Finally, and most importantly, use aseptic technique rigorously. This includes sterilizing the site with chlorhexidine and wearing sterile gloves. Contamination can lead to false positive results which complicate diagnosis and treatment, and we will talk about this later. By following these practices, you will significantly enhance the quality of blood culture procedure, and which also will lead to better patient outcome. Understanding the different types of blood culture bottles and their uses is critical for effective diagnostics. We have three main types of bottles. First, we have the aerobic bottles, which are used to recover bacteria that requires oxygen to grow. Second, we have the anaerobic bottles, which are designed for organisms that thrive on low oxygen environment. Third, we have the pediatric bottles, which are for small volume collections in children. Each bottle contains specific additive to enhance pathogen recovery. For example, activated charcoal neutralizes antibiotic that may already be in the bloodstream, while resin beads help bind antimicrobials, increasing the likelihood of detecting pathogens. When choosing bottles, always consider the clinical situation. For suspected sepsis, both aerobic and anaerobic bottles should be used to ensure broad coverage. In special cases such as fungal infections, a fungal specific bottle may be required. Lastly, accurate labeling is essential. Always include the patient's full details along with the site and time of collection. This ensures traceability and reduces the risk of processing errors. By selecting the correct bottles and using them appropriately, you lay the foundation for reliable blood culture results and timely patient management. Proper transport and storage of blood culture samples are crucial to maintaining the integrity of the specimen. First, ensure that the samples are transported to the laboratory within 2 hours of collection. Delayed transport not only increases the risk of contamination but also compromises the viability of certain pathogens. The temperature of the sample is equally important. Always keep blood culture bottles at room temperature and do not refrigerate them. Of course, the reason for that is that refrigeration can inhibit the growth of some organisms and potentially leading to false negatives. To minimize delays, use a mnemonic tube system if your facility has one. For off-site collections, ensure a reliable same-day courier service to deliver the samples directly to the lab. During transit, check that the bottles remain intact and free from leaks. Also confirm that the labeling is accurate and securely attached to avoid any mix-ups. By following these transport and storage guidelines, you ensure the highest accuracy in diagnostic result, leading to a better clinical outcomes for patients. Once blood culture bottles reach the lab, processing begins to ensure timely and accurate results. Bottles should be loaded into a continuous monitoring system immediately upon arrival. This ensures that any microbial growth is detected as quickly as possible. Incubation times vary depending on the suspected organism. For most bacteria, a standard incubation period of 5 to 7 days is sufficient. However, extended incubation may be required for fungi or slow-growing bacteria like Brucella. Modern automated systems monitor bottles for signs of microbial growth. These systems typically detect changes in CO2 levels or fluorescence as indicators of organism metabolism. Once a bottle is flagged positive, the lab performs a gram stain to quickly identify the organism morphology. Positive cultures are then subcultured into agar plates to isolate the pathogen. From here, identification tests and antimicrobial susceptibility testing are conducted to guide treatment decisions. This structured approach ensures reliable diagnosis and facilitates the delivery of appropriate and timely patient care. Modern blood culture systems use advanced technology to detect microbial growth in bottles automatically. The key principle is that microorganisms metabolize nutrient in the culture medium, which will produce high products such as carbon dioxide, acids, or gases. These changes serve as an indicators of microbial activity. There are three main detection methods. The first is CO2 monitoring, where the CO2 production reacts with a sensor in the bottle. Of course, it will cause a measurable range in fluorescence or color. This is commonly used in systems like Bacteremia. The second method is pressure monitoring, seen in systems like Versatric, which detect changes in gas pressure caused by microbial growth. Lastly, some machines use turbidity detection, measuring how microbial growth scatters light as the culture medium becomes cloudy. These systems continuously monitor each bottle, scanning every 10 to 15 minutes. This real-time detection allows for early identification, often within 24 to 48 hours, significantly reducing diagnostic delays. When a bottle is flagged positive, the system alerts lab staff with sounds, visual notification. Then the bottle is removed for further testing. This will include gram staining and subculturing to identify the pathogen and determine the most effective treatment. So once a blood culture bottle is flagged positive, the sample must be subcultured into specific agar plates to isolate and identify the pathogen. The first plate we have here is blood agar, a general purpose medium that supports the growth of most bacteria. Blood agar is also available for observing hemolysis pattern, which can provide preliminary clues about the organism, whether it shows alpha, beta, or gamma hemolysis. Next, you can see here we have the chocolate agar, an enriching medium designed for fastidious organisms that may not grow well on blood agar. It's essential for isolating Haemophilus species or Neisseria meningitis and similar pathogens. McConkey, on the other hand, is a selective plate for gram-negative bacteria that will differentiate lactose fermenter bacteria like E. coli, which will produce pink colonies, from non-lactose fermenter bacteria like, for example, let's say Pseudomonas, Proteus, or Salmonella, which produce colorless colonies. Finally, saccharose dextrose agar, which will be used, as you can see here, will be used to recover fungi and yeasts, especially Candida species, which are important bloodstream pathogen in immune-compromised or critically ill patients. By inoculating these four media types, we ensure a comprehensive approach to identifying a wide range of potential pathogens in blood cultures. The ground stain is one of the most fundamental techniques in microbiology, widely used to differentiate bacteria into two main groups, gram-positive and gram-negative. This distinction is based on the composition of bacterial cell wall. So let's go through these steps and we will start with crystal violet. In this step, we apply crystal violet, which binds to the peptidoglycan layer in the bacterial cell wall. Gram-positive bacteria with their thick peptidoglycan layer will retain this dye, giving them a purple color. Next is iodine, which will be added as a mordant and it will form a complex with the crystal violet, enhancing the dye retention in bacterial cell and stabilizing it within the peptidoglycan. Third, we have the alcohol decolorizer, which for me I believe it's the most critical step in the gram stain process. This step comes with alcohol or acetone decolorizer, and it removes the crystal violet iodine complex from gram-negative bacteria, which have a thinner peptide layer and an outer membrane. As a result, the gram-negative bacteria becomes colorless. Final step, the safranine. We apply this safranine as a counter stain. This red dye colors the now colorless gram-negative bacteria, allowing us to visualize them distinctly. Gram-positive bacteria, on the other hand, retain their purple color from the crystal violet. This simple yet powerful technique helps microbiologists identify bacteria quickly and guide initial diagnostics and therapeutical decision. As you can see, the gram stain isn't just a laboratory procedure. It's the cornerstone of bacterial identification and classification. Interpreting blood culture results is a critical step in diagnosing infections and guide patient care. For positive cultures, we just discussed it in the previous slide. We will do gram stain. This provides immediate insights into the type of organism, such as gram-positive or gram-negative bacteria, allowing clinicians to make early treatment decision. It is essential to notify the clinician immediately for clinical results, such as potential sepsis-causing pathogens. Positive cultures are then subcultured for further identification and antimicrobial susceptibility testing to ensure the most effective therapy. We talked about it before, culturing on 4 different types of media, such as blood, McConkey chocolate, and Sardix. For negative cultures, it's standard to report after 5 to 7 days of incubation if no growth is detected. However, in certain cases such as suspected endocarditis or brucella infections, extended incubation may be required to rule out slow-growing organisms. So in case there is a positive blood culture bottle, we have 2 scenarios. It's either true positive, true pathogen, or a contamination. How to differentiate from these two types? Usually, true positive, you will find the organism. For example, E. coli, you will find it in multiple bottles. For example, if the physician asks or sent 6 bottles for this patient, you will find it in 5 or 6 of these. In this way, you will say yes, this is a true positive. Contamination, you will see it a lot. You will see 6 bottles for one patient, with only 1 positive bottle for, let's say, staph epidermidis. So that's usually how we distinguish. By the way, if, for example, if I find coagulase negative staph in 4 bottles or 6 bottles from one patient, usually it's considered to be pathogenic. Usually it's the true positive, it's the true pathogen. The correlation is very important. Some people say it's not the job of microbiologist, it's the job of the ID consultant. But for me, I believe the microbiologist should always correlate his results to patient history. Blood cultures frequently detect a wide range of pathogens, which can vary based on the patient's condition and the site of infection. Among gram-positive bacteria, like for example Staph aureus, which is a major cause of sepsis and endocarditis, while Streptococcus pneumoniae is commonly associated with pneumonia and meningitis. Enterococcus species are often linked to infections originated from urinary or gastrointestinal tract. Gram-negative, on the other hand, plays a significant role on the infection or in the sepsis. You can see, for example, E. coli is the most common gram-negative pathogen, particularly in cases of sepsis originated from urinary tract infections. Pseudomonas aeruginosa is frequently seen in immunocompromised patients, and Klebsiella species are commonly implicated in healthcare associated infections. In addition to bacteria, fungi such as Candida species are significant pathogens, particularly in immunocompromised patients or critically ill patients. However, not all organisms detected in blood culture are true pathogens. Skin flora such as Coagulase negative staph and Corynebacterium species are common contamination. Determining their clinical relevance depends on the patient conditions, symptoms, and the quality of specimen collection process. Identifying these pathogens and understanding their significance is critical for guiding effective treatment and improving patient outcomes. Okay, now that's an important slide. Maybe it's coming late, but I chose to put it at this part. In this slide, I will discuss the important difference between bacteremia and septicemia. Bacteremia refers to the presence of bacteria in bloodstream. It may occur after a malware infection, as we discussed in the beginning of this video, the transient part. It will come after dental work or surgical procedure, while septicemia is the result of uncontrolled infection spreading through the bloodstream. These symptoms you can see for bacteremia, it's usually mild, often asymptomatic, or mild fever and chills, or chills actually. Severe symptoms, on the other hand, with the septicemia, like high fever, chills, rapid breathing, and confusion. Usually, the bacteremia may resolve by its own, maybe by the immune system, and doesn't need a medical intervention and treatment. However, in septicemia, the medical intervention is important, and the case will be life-threatening if not treated. So in bacteremia, usually harmless, and if of course if it's transient, but in septicemia can progress into septic shock and organ failures. Last, may not for the treatment may not require antibiotic if mild or transient. But for septicemia, that's very important, requiring immediate medical intervention, including antibiotics and supportive care. When it comes to medical intervention in septicemia, usually if we start the intervention within the first hour of diagnosing the septicemia, it can save patient life by 80%. Despite being a cornerstone of diagnosing bloodstream infections, blood culture diagnostics face several challenges that can impact their accuracy and utility. Contamination is one of the most common issues, leading to false positive results. This can cause unnecessary treatment, increased antibiotic use, and extended hospital stay, which are both costly and potentially harmful to patients. Another challenge is detecting infections with a low pathogen load. This is particularly a problem in early stage infections or when antibiotics have already been started. In such cases, repeated blood cultures may be necessary to improve detections. False negatives, on the other hand, especially with slow growing organisms like Brucella or fungi, these pathogens may require extended incubation time or specialized medium to grow. Polymicrobial cultures, where multiple organisms are detected, can complicate interpretation. So, correlating the lab results with the patient clinical history is critical in such cases to determine the significance of each organism. Finally, delayed reporting due to the traditional culture process can impact treatment decision. Advances in rapid diagnostics methods such as molecular assay offer hope for faster and more accurate results, reducing these delays. Understanding these challenges and how to address them is essential for improving the accuracy and efficiency of blood culture diagnostics. Blood culture diagnostics play a vital role in patient care, especially in the context of life-threatening conditions like sepsis. By providing a timely diagnosis, blood culture enables the rapid identification of pathogens, allowing the physician to get the exact or the correct therapy for the patient. This can be the difference between life and death, especially in critically ill patients. The use of blood cultures significantly improve patient outcomes. Early intervention not only reduces mortality rate in sepsis but also prevent complications that can arise from delayed or inappropriate treatment. In addition to that, blood cultures are the cornerstone of antimicrobial stewardship program. They help clinicians select the right antibiotic, avoid unnecessary treatment that contribute to the growing problem of antimicrobial resistance. Blood cultures are especially critical in complex cases, such as infections in immune-compromised patients or when dealing with polymicrobial infections. They provide critical insights that guide clinicians or clinical decision in these challenging scenarios. Finally, blood cultures are not just for diagnosis, but also for monitoring and follow-up. They help confirm the effectiveness of treatment, detect relapses, and identify treatment failure, ensuring that patients receive the best possible care. This comprehensive role highlights why blood cultures remain an indispensable tool in modern medicine. Okay, now we are almost finished with our course. I have some questions. We will read and answer them together. First question: which of the following is the best sample for detecting Brucella species in cases of suspected brucellosis? Is it sputum, blood, bone marrow, aspirate, or cerebrospinal fluid? Okay, if you want to think about it, just hit pause. I will go to the answer. Bone marrow aspirate. I know some of you might find this to be surprising, but bone marrow aspirate is considered to be the most sensitive sample for detecting Brucella because it provides a high yield, especially in chronic infections. Next question: which of the following factors most significantly affects the yield of blood cultures in patients with recurrent bacteremia? Is it the volume, the use of anaerobic bottles, the presence of raisins, or the incubation temperature? I will go to the answer. The volume of blood collected. The amount of blood collected is critical as it increases the likelihood of detecting organism presence in low concentration. This is why we talked about this before. We said it's recommended to collect from 2 to 3 sets with 20 to 30 ml per set. Next question: what is the primary role of raisin bees in blood culture bottles? Enhance the growth of anaerobic organism, neutralize antimicrobial agent, maintain a pH in the bottle, or provide nutrition for fastidious organism. We spoke about this also, neutralize antimicrobial agents, because raisin beads bind to the antibiotics in the patient's blood, reducing their effects and allowing for bacterial recovery. Next, a neonate. Okay, a neonate with meningitis. Immediately when you see a neonate with meningitis, the first thing you will think about is group B Streptococcus agalactia. So a neonate with meningitis has blood culture positive for gram-positive chain, which additional test is crucial for determining the likely pathogen. We have obachine, bacitracin, CAMP, or coagulase. The answer is CAMP test. The CAM test confirms Streptococcus agalactiae, group B Streptococcus leading, which is a leading cause of neonatal meningitis and sepsis. Next, which of the following pathogens is most likely to require extended incubation of blood culture beyond 7 days? This is an easy one. Is it E. coli, Haemophilus, Procella, or Streptococcus pneumoniae? The answer is C, Procella, because Procella is a slow-growing organism that may require extended incubation for detection. Next, which of the following condition is most associated with the recurrent isolation of Clostridium perfringens from blood culture? Is it septic arthritis, colon cancer, pathogenic valve endocarditis, or diabetic foot infection? The answer is colon cancer. Clostridium perfringens bacteremia can indicate gastrointestinal malignancy, especially colon cancer. Next question, which of the following pathogens require a specialized medium such as BCYE for optimal recovery from blood cultures? Is it Legionella, Neisseria, Procella, or Bacteroides? Legionella. Legionella requires BCYE medium, which because this organism cannot grow on standard blood agar medium. Next, which statement best explain why pediatric blood culture bottle typically contain less volume of media compared to adult bottles? Is it because pediatric pathogens grow faster in small volume, or to reduce media or is it because reduced media volume prevents sample dilution, maintaining pathogen concentration, or smaller bottles reduce the risk of contamination in pediatric samples, or the pediatric bottles are designed for or to enhance fungal recovery? The answer is B. Reduced media volume prevents sample dilution, maintaining pathogen concentration, because smaller volume maintain an optimal pathogen to media ratio, critical in pediatric samples where less blood is collected. Final question we have here: a pediatric patient with a central venous catheter develops sepsis. Blood cultures are positive for gram-positive that are catalase positive and coagulase negative. Which organism is most likely responsible? So we say it's a gram-positive bacteria that is catalase positive. Immediately when we said catalase positive, you will roll out C and D. You will have to answer Staphylococcus aureus or Staph epidermidis. Now it says also coagulase negative. This is immediately you will roll out Staph aureus and you will have the answer is B, Staphylococcus epidermidis, because Staph epidermidis is a coagulase negative staph frequently associated with catheter related bloodstream infections. Okay, this was the end of my presentation. I hope you enjoyed it and I hope you find it to be helpful and informative. And if you do so, please share it with your friends, share it with your colleagues. And if you have any inquiries, any questions regarding this topic or any topic, please feel free to reach out at any time. I am Jamal Arbai, and thank you so much.